drift effectively is when your hands are moving even though you aren't really aware that they are moving. So there's a position like this in Tai Chi where we're going to drop back into the back foot, and then as we come around, you're going to watch the arm nearest the camera. As we come around, that arm nearest the camera stops there. So the arms are moving here with the body. I'll drop this hand so it's out of the way. And then as we come back, the hand moves with the body, with the body, with the body, with the legs, and I stop there because my waist has stopped there. Now if I want to go further, the waist has to go further as well, but that's actually starting then to stress my ankle and knee and putting me out of position because I want to be this lovely midline. So we come to this point here. Now at this point here, normally what happens is when you start beginning with Tai Chi, the hand just keeps going. So you do this, you go like this, you come forward, I'll slow it down, my waist stops there, and my hand just drifts. And sometimes it drifts like all the way over here. And the teacher will say, stop, and they'll come round, and you're like, why is my hand over here? And everybody's hands is in front of their face. And they'll move them 3 or 4 inches. And that often happens in practice when we work with patients. I tell you, I'd be amazed if you're not doing this. It may only be micromillimeters, but I bet you're doing this. Because in Tai Chi, when we do this, we can have that movement that can be inches, but in the body, when you're working on a patient, let's say you're doing articulation, well, what can happen is, if you're drifting, only a tiny amount of drift is a huge amount of change through that joint, through that body. Commonly, what we'll see is when you're doing articulation when the patient is seated, especially we saw in the last video when a person has a lot of mobility, is that what happens is you're doing your one hand around the body, you're putting that articulation in, and then you keep going, and there's this kind of movement where you're not doing anything. You're not articulating anymore because these two are actually working together. This one is going at the same pace as this one. So you're not getting any articulation through the thoracics. All you're doing is moving their pelvis more. And so often this drift is the issue between being really effective with patients or being partially effective, or the difference between when you get a treatment reaction and you don't get a treatment reaction. Because have you ever articulated someone in their thoracic, or actually I'll put it this way, has anyone ever worked on you, they're articulating through your thorax or working somewhere, but actually you end up getting strain lower down through the body. Because what happens is you get to the end range of what you're capable of in the body, in that joint, and then the body says, I'm not going any more there, I'm going to start spreading it down the system. And the patient and the practitioner doesn't feel that because they're drifting, so they put more in that joint. That joint doesn't move anymore, it gets passed down, and you end up straining the QL or straining down through the lower back, etc., etc. Very, very common. So do watch out for the drift, and the way you get rid of that drift is just simply paying attention, paying absolute focus. Not just when you're in with a patient, but when you're walking around. You see people are sloppy, really sloppy, they bump into things, but even if they don't bump into things, they're kind of like all over the shop. Start having more of a martial mindset in your body when you work, and I don't mean by that martial mindset doesn't mean go around beating people up and being nasty to them. A martial mindset, gung fu, is an internal discipline where you're just working on yourself. It's the same way you say to patients, when you say to them, hey, that shoulder, we worked on that, it's great change, but you're going to have to work on these exercises to stabilize now through that lower trapezius. Because there's 23.5 hours and 6 days a week when they're not with you and only half an hour when they are. So you need them to establish that routine. Same I'm saying for you here. Yes, you've got this principle, practice when you're with the patients, but also practice outside. When you're at the table and you're reaching for that salt, when you're reaching for that plate, start feeling what's happening with your body. Start paying attention to what you're doing. It will make huge differences, not just in terms of what you're doing in your practice with your patient, but also in your life in general, in terms of your focus. Especially if people might accuse you of being a little bit scatty. I'm not saying you are, but if you've had that bit of that dreamy type of thing, and a lot of practitioners are because we're intuitive and we work with that. Well, if you can add this little bit of focus to that, wow, that's an absolute amazing combination.